Hi, everyone, and welcome to This Week in Global Health, a regular news and relevant topics in global health series. Today, we have a very special episode that was produced while TWiGH attended the World Health Assembly in Geneva last month. So TWiGH was invited to attend a side event that was put on by Novartis Access Initiative and interview panelists at this event about how the Novartis Access Initiative is helping to increase access to medicines for non-communicable diseases. Now, non-communicable diseases are increasingly becoming a major issue around the world, and it's not just in the global north. So getting access to medicines for non-communicable diseases is really important, and because there's increasingly more people that are needing them around the world. And these medicines have to be accessible, and they have to be affordable as well. So Yvonne and I had the chance to interview panelists on these issues and specifically ask how Novartis Access is helping to improve access to medicines for NCDs. We had a lot of fun, and we learned an enormous amount. Here are some highlights from the event.
Hi, I have here with me Dr. Harold Nusser, who is the Global Head of Novartis Access, and I'm here to ask him some questions. Hi, nice to meet you. So can you maybe give our audience a brief overview of what Novartis Access is?
Novartis is known for having a lot of access programs, for example, the not-for-profit malaria initiative, the leprosy donation program, various oncology patient access programs, and the Aroga Pariva program for the bottom of the pyramid in India. Yet what was missing some time ago was to have a really comprehensive approach to target non-communicable diseases, and that's what Novartis Access stands for.
Thank you. So what prompted the creation of Novartis Access? Why non-communicable diseases? What is the situation of that in low-income countries right now?
Non-communicable diseases are a silent killer, oftentimes asymptomatic, and what is a major threat for societies is that particularly in low and lower middle income countries, the major disease burden is affecting many people's lives in terms that more than 75% of all the premature deaths occur from non-communicable diseases in the world, from those low and low middle income countries.
So which non-communicable diseases do you target?
It's four main NCD areas: cardiovascular diseases, including hypertension and dyslipidemia and heart failure. It's diabetes type 2, breast cancer, and respiratory illnesses.
And how did you choose those four? Why those four?
Those are the four main non-communicable disease areas, also causing premature deaths. There are other NCD areas, however, they do not immediately cause premature deaths. So that's why we initially wanted to focus on those four disease areas, particularly because the field is so big, and we are really the first one doing that courageous step, leaving our comfort zone, and yet we are facing so many unknowns that we simply did not want to overdo it in the first step and really learn and adjust the program as we go. The program is about a portfolio approach of 15 really important life-saving medicines to treat those four NCD conditions: cardiovascular, diabetes type 2, breast cancer, and respiratory illnesses. And it's not only a portfolio offering that we offer to governments and non-governmental organizations, it is really coming along also with capacity building elements, like medical capacity building and capability building in the sense of screening mechanisms, diagnostic and referral mechanisms, and really training healthcare workers. Secondly, integrity of the distribution chain is absolutely key for three reasons. First of all, the treatments need to be available for those chronic conditions when they are needed, also in peri-urban and rural areas. Secondly, we definitely must avoid proliferation into areas in the informal sectors, which are also existing. And last but not least, to really avoid excessive markups towards the patient downstream in the countries. And the third main element of that capacity building, what is associated with the program, is really a sound and scientifically rigorous measurement and evaluation program. So apart from the public side, from the ministries of health, for example, We really partner with non-governmental organizations like, for example, Management Sciences for Health, in the sense of assessing integrity of distribution chains. And for the measurement and evaluation piece, we collaborate with Boston University. For medical capacity building in our first pilot country, which is Kenya, we are working very strongly together with the Christian Health Association of Kenya and the Kenya Catholic Church of Bishops, and also with the Kenyan Red Cross.
Thank you. I know this was introduced in 2 countries last year, so what is the progress right now? Is it smooth?
We have ambitious targets, which we have also made public on our website. So along with introducing the program to other countries and really entering a first dialogue, introducing the program, we also want to file more than 400 submissions of our portfolio into more than 20 countries in the world this year.
Oh, wow.
And also explore innovative financing options, because, as we said, we cannot possibly do it alone. And for the reason that only 1 to 2% of all the global donor money is going into the NCD space, we really need to be creative and try to figure out innovative financing options, and maybe to tap into the capital market to raise funds and money and support potential investees.
I see. And lastly, so what do you think is the role of the private sector in help promoting universal health coverage, since this is such a big topic right now in relating to the Sustainable Development Goals?
The private sector can play an important role, yet the public sector really needs to own all programs in terms that they need to be homegrown. There is no sense in superimposing some European-based or Chinese-based programs onto a developing country and simply say, this will work in your country. It really needs to be an explorative process and a partnering process where we can offer help, and particularly the private sector can offer support. And then nobody really knows how this will unfold. There may be paradigm shifts involved. There may be leapfrogging initiatives. So let's see how the world is looking like in 5 to 10 years from now.
Thank you. That's really exciting.
All right. Well, thank you, Dr. Lang, for sitting down with us. You are a professor at Boston University School of Public Health, Department of Global Health, correct?
That's right.
And we're really excited to talk to you today. We're excited to attend the Novartis Access event later today. But before we get into your experience and your thoughts on this new initiative, I wonder, could you tell our audience, what is your background and association with access to medicines and the non-communicable disease field?
Yes. I'm originally from Zimbabwe in Africa and worked in the Ministry of Health there for 18 years. And part of the program we had there was around what we called at the time chronic diseases. Okay. Then I moved to the United States and worked for an international consulting organization doing access to medicines and rational use work. Right. And that led me into Boston University, where I worked mostly on pharmaceutical access and policy issues, which I came to WHO 15 years ago, and worked in WHO for 10 years on pricing of medicines, availability, national medicines policy, and in the last few years, very much around the chronic disease, non-communicable diseases issue. Okay. And so one of the big issues that we faced when I was in WHO was how to get the pharmaceutical companies to measure the access initiatives that many of them were undertaking. Novartis was one of the leaders, but many of the other companies were doing initiatives. And by the time I left WHO, we hadn't succeeded. Mm-hmm. And so I was very pleased when Novartis came to us a year ago to say that they were interested in having us evaluate what for them was an exciting initiative mm-hmm. of providing access to non-communicable disease medicines.
Right. So you're involved a lot, like you said, like Novartis came to you for the evaluation of it, and you're an academic professor, that you're involved in that way. What do you think the role is of academia in doing these evaluations and yeah?
Yes. Academics have a different role to pharmaceutical company scientists in that we are interested in applying general methods or methods that are applied in other environments to specific situations. And so what's exciting about this program is that we're being able to apply a randomized controlled trial model to a health system. We're using interrupted time series to look at how the medicines are actually going through the system. And we're using qualitative methods to find out what difference this makes to individuals at the household level and also at the facility level.
Okay. Now, I know that you spoke a little bit, there was an event earlier today, and you talking about these new methods. The things, RCTs are, that's not necessarily a new method. What is something innovative that you are doing at the moment with this?
Yes, RCTs applied to health systems interventions are very rare. We have done a systematic review of all of the 347 access initiatives that all the companies have done. Not a single one of those is an RCT. 2 of them are interrupted time series, and many of them are pre-post with a control group, which is a very weak methodology.
Right.
So what's innovative in the program that we're proposing is the application of a randomized controlled trial, and we're clustering the counties to intervene and not to intervene and to measure the effect. What's most innovative, which hasn't been done before, is the use of telephone monitoring as a basis for evaluation. Kenya is a country with a very high uptake of telephone communication. And so what we're hoping to be able to do is to call the households and call the facilities every month and on a rotation, so nobody gets called too often, to find out how things are going. Have they bought any medicines? Where did they buy them? What did they pay for them? Have they been, what's happening with the process? And by doing that, we're hoping to be able to simplify the process of evaluation, because this Novartis Access Initiative is aspiring to deliver these medicines in 30 countries. Now that's a very big program.
Absolutely.
And to do the adequate evaluation in all of them, we need to simplify the methods, and that's one of the things we're hoping that will come out of this study, is that we will learn from this large study how much smaller the studies could be to do the evaluation, so that every access initiative, not just the Novartis Access Initiatives, initiatives for all the companies, could be evaluated in a systematic, standard way. And then we can also measure and compare the performance of companies, which is what the Access to Medicines Index does, which is in many ways a major motivator for companies.
Now, you mentioned there's a lot that we can learn with this new study, and now in the way I've known about access to medicines has been a lot about infectious diseases.
Yes.
And I'm wondering, what are the unique challenges with measuring progress with non-communicable diseases?
Yeah, it's a big difference, and health systems have to be transformed. In acute and infectious diseases, people are ill, they're too ill to work, and they need immediate care. In chronic diseases, once the patients have been diagnosed, initiated on treatment, they are coming for resupply and monitoring. They are well. They don't want to hang around waiting, but they can't come and have the products out of stock. A diabetic who comes to a facility for insulin and the insulin isn't available, 3 days later that patient will be dead. So it's a life-saving medication for many of these conditions, but continuity of care is critical. The other big issue is that the patients become experts in their own conditions. So for an acute illness, the first times a child has malaria and the mother takes it, the mother may not have expertise. But the diabetic who's been a diabetic for 10 or 15 years, they know about their condition and they know what affects it, and it's the diet and the exercise and the medication that they're facing.
Right.
So having a health program that caters to educate them, patients may be illiterate, but they will be expert at the same time.
That makes sense. I can see differences there.
Yeah.
For sure. What would you say are the key takeaways from this meeting and your thoughts on the Novartis Access?
I think the key takeaways is it's complicated to do evaluation of chronic disease access initiatives. Clearly the burden of disease is shifting now from the acute infectious diseases to the chronic diseases, even in Africa, which is the last holdout almost of infectious diseases. So learning how to do this effectively, efficiently, in a sustainable way is going to be a challenge for everybody. It's going to be a challenge for ministries of health, for the communities that are facing these challenges and these problems, but it'll also be a challenge for the pharmaceutical industry, because in these cases it may not be new molecules or new formulations, it may be new systems of delivery, new monitoring, new partnerships that will happen, that will make their medicines be as effective as they could be.
Yeah, I definitely agree with you. I think that's the way things are going, and there's so much that can be learned. And like you said, with the burden disease increasing in non-communicable diseases and developing countries, seeing more of the prevalence of those diseases, it's so important that we focus on these things and think about that. So couldn't agree more.
And to be open to new ways of doing things,
because
it's a different world that we're talking about.
Absolutely. No, that's great. That sounds wonderful what you guys are doing. So could you tell me exactly how you are involved and Boston University is involved with the Novartis Access?
Yes. In our Department of Global Health, we have a very active unit that does monitoring and evaluation. So we have a lot of experience of monitoring and evaluation programs, which are health systems usually rather than pharmaceutical or clinical cases. What is exciting for us on this program is that it is for a chronic disease, a long-term non-communicable disease. And so what we're looking at is what are the methods that already exist for acute disease, whether it's clinical or health system, how can we apply that to lifelong care? How can we look at using those methods and apply them in those circumstances? And for that reason, what we're looking at is, in addition to the standard randomized controlled trial, which is looking at an event, a treatment, and an outcome, we will be going beyond that. We will have a baseline, midline, and 1 year and 2 year evaluation. But we will also be doing monthly monitoring using a telephone system so that we'll be able to see how changes are happening when they're happening. And we will combine that with qualitative in-depth interviewing both at the facility and at the household to try and find out, does this initiative change perceptions, attitudes, beliefs, and practices as far as these medicines, as far as these diseases are treated. And that for us is an exciting area too, because we haven't looked at chronic long-term diseases much in terms, except if we talk about AIDS and antiretrovirals, because now what we're seeing, and particularly we have an active program in South Africa where we have, and Zambia, where we have long-term cohorts of mothers who've been HIV positive and have had children and have been followed up. So what we're taking is some of the most exciting messages and experiences from treatment of AIDS and saying, can we apply that to diabetes or heart disease or lung disease?
So as you can see, the event was a huge success, and Novartis Access is really doing great work with this initiative in helping to increase access to medicines for NCDs. But what do you guys think? Here at TWiGH, we love to hear from our audience, and there are a number of ways you can interact with us. You can comment on this video and leave comments in the comment section, or you can tweet at us, or you can leave feedback on our Facebook page. And if you like this episode and you want to watch more, please subscribe to our YouTube channel, This Week in Global Health. And you can find more episodes also on our webpage. It's TWiGH.org. And we also have LinkedIn, Twitter, Facebook, Instagram, and we have a blog. So you can find us and check us out there. And for those of you that prefer to listen rather than watch, you're in luck because we have a purely audio podcast as well. So check us out there, and you can find that specifically through iTunes. Well, that's all for now. Come back soon and interact with us. Bye.